Blastomyces dermatitis is a type of fungus that will manifest and cause blastomycosis. It's most common in the southeast United States and it will extend north of Canada. Some cases have even been reported in Latin America, Asia, Europe, and Africa. It grows mainly in full damp soil that's abundant in organic matter such as animal waste or decaying vegetation. It's contracted through airborne fungal spores from the soil. For example, if someone's cut the grass and they stir up the dirt, then someone can breathe it in that way. It only takes a small amount to cause a disease. The number of people that are getting blastomycosis is increasing, mainly in people with a low immune system. Pulmonary blastomycosis is the most common form of the blastomyces infection. The spores enter the lungs once inhaled and they're converted to yeast forms and multiply. This will cause the person to have pulmonary lesions. Symptoms include things such as muscle aches, cough, fever, chills, and weight loss. Pus-filled lesions develop as the yeast cells multiply. Sometimes this can cause a deep cough and chest pains. Relatively healthy people are easily cured of this disease, however, it can become chronic. People with AIDS are at high risk of respiratory failure and death. If the fungus spreads beyond the lungs, the person can have cutaneous blastomycosis. This occurs with 60 to 70% of patients. They'll get lesions on their face and upper body. These lesions can be wart-like or crater-like, and in some cases, it spreads to the spine, pelvis, brain, ribs, and long bones. Once it's reached the bones, it's called osteoauricular blastomycosis. AIDS patients can get meningitis from the blastomyces fungus spreading throughout their nervous system. Diagnosing someone with blastomycosis depends on how it's identified. The doctor will get samples from sputum, bronchial washings, biopsies, cerebrospinal fluid, or skin scrapings and view them under a microscope. It takes about 10 weeks to treat and get rid of this fungus with the right medication. It's common for the AIDS patients to relapse after they've been cured.